Hello all, welcome to the channel. Myself Dr. Raghunarayan. Yes, today we'll be discussing regarding the Ebola virus. Is Ebola back? Yeah, once again the world is talking about Ebola. A dangerous Ebola outbreak in Africa is raising global concern. Thousands are being monitored, hundreds have feared death. Health experts are warning that this outbreak is spreading rapidly in some regions. So, what is exactly happening? Is the world again at risk? Today, let's understand the current Ebola outbreak in simple language. So, what is Ebola? Ebola virus disease is one of the world's deadliest viral infections. It causes severe fever, vomiting, diarrhea, internal bleeding, organ failure. Some outbreaks have shown mortality rates up to 50 to 90% also. That is why Ebola terrifies the world. So, coming to the current outbreak 2026, right now major Ebola outbreaks are being reported mainly in Democratic Republic of Congo, parts of Uganda. According to the recent reports, hundreds of deaths are suspected, many more cases are under investigations. Health agencies are working aggressively to contain the outbreak also. Why this outbreak is worrying? One of the major concern is that the current outbreak involves the strain of Ebola, that is Bundi Bugyo. Experts says there is no fully approved vaccine for this strain. Treatment options are limited. Some affected areas are difficult to access. This makes outbreak control more challenging also. How this Ebola spreads? Ebola spreads through direct contact with blood, vomit, saliva, sweat, body fluids. It does not spread casually like common cold viruses. Healthcare workers and family members caring for infected patients are at highest risk in this. So, coming to what are the early symptoms of Ebola? The early symptoms of Ebola may resemble like flu. There would be fever, weakness, headache, muscle pain, and later stages may become severe also, like vomiting, diarrhea, bleeding, shock, and organ failure also can be seen. Why the world is under alert? The world is alert because Ebola outbreak can overwhelm healthcare system quickly. Past outbreaks caused massive panic, international travel, screening, healthcare workers' deaths, economic disruption. Images of doctors wearing full body PPE created the global fear. Can it become another pandemic? Right now, experts says Ebola is not spreading globally like COVID-19. Why? Because Ebola mainly spreads through body fluids, as I already mentioned. Okay, and it is not airborne transmission. However, rapid outbreak control is still extremely important in order to control Ebola. What health authorities are doing in this? WHO and international health agencies are isolating the cases, tracking contacts, increasing protective equipments, improving testing, monitoring travel risk. Rapid containment is the main goal in order to control. Ebola taught the world important lessons like early detection save lives, strong public health systems matter, and protective equipment is essential. Global cooperation is crucial during the outbreaks. Preparedness is the biggest defense against dangerous viruses. So, hence, Ebola remains one of the world's most feared viruses because of its severity and high mortality. But awareness, science, and rapid public health response can prevent larger disaster. Stay informed but avoid panic. If you found this video useful, subscribe, and for further medical awareness and health education videos, subscribe the channel guys. Thank you. Dr. Raghu signing off. Bye bye.